Good afternoon, everyone. This is Nisha Gandhi with the California Department of Public Health. Welcome to our second introductory program overview for the California vaccines for adults. I'm in the room here with several folks here, and we'll cover some of the basic topics around the Vaccines for Adults programs. We want to thank you all for joining us, and we'll go ahead and jump right in. So before we start, I just want to let you all know that this broadcast, this webinar, is being recorded. And for those in the, if you have other staff in the office that you would like to see the slides or even listen to us speak, we plan to take today's recording and hope to have it posted on our website next week. And I also just wanted to give you a bit more familiarity with the platform that we're using today. I want to just instruct you on how to access the audio and submit questions. Here is a screenshot of an example of the attendee interface. You should see something that looks like this on your own computer. You're listening and using your computer's speaker system by default, as shown in the upper left red rectangle. If you would prefer to join over the phone, and we do highly recommend that you join over the phone, just select telephone in the audio pane as indicated in the red rectangle to the right, and the dial-in information will be displayed. You'll need to enter the access code and PIN provided. The orange arrow allows you to minimize and maximize panels throughout the presentation. After the presentation, we will have a Q&A session. At any time during the presentation, you may submit a text question by typing your question into the question panel of the control panel indicated in the lower red rectangle. We will collect these and address them during the Q&A session at the end of today's presentation. During the Q&A, you may also raise your hand to ask a live question by clicking on the hand you see circled in red. Please note that in order to ask live questions, you will need to have joined the webinar via telephone and have entered the access code and PIN provided. If you raise your hand, we will unmute your line for you to ask your question. Okay, with that, here is a table of contents that we will be covering in today's call. We'll do an overview, review patient eligibility, vaccine ordering and tracking, reporting requirements, materials and resources available to you, and then finally our question and answer portion. So I will now turn it over to Claudia Aguiluz for a program overview.
Thank you, Nisha. Good afternoon, everyone. I am really excited to be introducing our Vaccines for Adult program, a new program from the California Immunization Branch. Now, the California Vaccines for Adult program is a new program that expands access to 317 funded vaccines to a limited number of eligible federally qualified health centers, look-alike federally qualified health centers, and rural health centers in California. This expansion is part of a new CDC adult grant looking at expanding and increasing adult immunizations within this state. The Vaccines for Adult vaccine supply allows for the immunization of uninsured and underinsured populations within their medical home because these folks are already served by the clinics. Vaccine supply through this program are funded with limited federal funding, and this funding is known as Section 317. Next slide, please. So our program actually has four main key goals. The primary goal is expanding access to 317 funded vaccines to federally qualified health centers and rural health centers, as I explained in the previous slide, who are already providing healthcare services to uninsured and underinsured populations in the state. The second main goal is to provide vaccines at no cost to eligible adults within these organizations. And third is to integrate routine immunization recommendations as part of routine adult care within federally qualified health centers and rural health centers. And fourth, and it's key, is for us to learn about the essential aspects of integrating and coordinating adult immunization services within federally qualified health centers and rural health centers. This program is really a new initiative which is starting a foundation for implementing adult immunizations in these organizations. The timeline for the Vaccines for Adult program, vaccines will be available to approved applicants from June 10th, 2016 through June 30th, 2017, approximately a one-year period. There is an opportunity for a continuation of the receipt of vaccines, and this continuation is dependent upon available funding, and certainly may be beyond June 30th, 2017. Once doses are received, however, the clinic may continue to use the 317 funded vaccines for eligible populations through the expiration date of the vaccine. This means that if a clinic has remaining unused doses past June 30th of 2017, these doses can continue to be used throughout the expiration date for the vaccine. So talking about vaccines, the vaccines that are available through the program are most vaccines that are recommended by the Advisory Committee on Immunization Practices, or ACIP. Vaccines include hepatitis A, hepatitis B, HPV, MMR, MCV, and a long list of vaccines are included in this slide. A note for vaccines that are not available through VFA include flu, influenza vaccines, and meningococcal B vaccines. As with any federal program, this program is funded by Section 317 federal funds. So it has a set of participation requirements that all approved sites must review, comply, and ensure that are implemented throughout the approved organizations. Most of the sites that are approved as part of VFA are also existing VFC providers. So many of you are already very well and familiar with all of the requirements for vaccine management, vaccine storage, and additional participation items were listed in the 317 provider agreement and certification of capacity to store and manage vaccines that was included as part of the application process. I'm not going to go through all of these, but just to highlight, requirements include making sure that vaccines are only administered to eligible populations. Eligibility, screening, and documentation occurs. Vaccines are administered in according to ACIP schedules. Fees set for vaccine administration are followed. Vaccine information statements are provided. And then documentation and reporting and tracking record retention requirements apply. One aspect of this program, and I want to make sure that to emphasize, is that vaccines that are received by approved sites are only to be maintained and administered at the approved site, and vaccine redistribution among non-approved sites at this point is not allowed. So now I would actually like to turn it over to Nisha to talk a little bit about eligibility and eligibility documentation and tracking.
Thank you, Claudia. Okay, so who is eligible to receive VFA 317 vaccines? The populations eligible are uninsured and underinsured adults, 19 years of age and older, served by your clinic. Uninsured is defined as a person without any health insurance coverage, public or private coverage. Underinsured is defined as a person who has health insurance, but the coverage does not include vaccines, or a person whose insurance covers only selected vaccines. So we will also note that the next bullet contains 3 situations where the patient is not eligible to receive 317 vaccines. So if a person has an insurance plan that includes a high deductible or copay, or if a claim for the vaccine cost and an administration is denied because the plan's deductible has not been met, or the individual's insurance has cost sharing, these persons must pay out of pocket for immunizations. Note, unlike the VFC program, adults with Medi-Cal are considered insured and therefore not eligible. Seniors without Medicare Part D are considered underinsured. Okay, so we're going to do a quick poll here. True or false, Medi-Cal beneficiaries are eligible for vaccination under California VFA program. Opening the polls right now, and we will see what folks say. Let's see here. Okay, looks like most of you are right. So it is a false statement. As stated, Medi-Cal is an insurance program. It is a public insurance program, but it is considered insurance, and therefore a patient is considered insured and not eligible for the VFA program. This is important to note because it is different from the VFC program, the Vaccines for Children program, which you are all very familiar with. So before I go into the eligibility guidelines, we held a similar webinar on Tuesday, and we did get a lot of questions on the very nuances of different insurance plans that cover vaccines and whether or not certain plans cover it or don't cover it. And what we recommend for you to do is take a look at how when patients come in and you're doing your intake form and you're collecting insurance information, all that information is there, and that should help guide you on whether or not a patient is insured or not. Also, it's an internal decision to look at which insurance plans you are accepting within that clinic. So we will continue to help out as much as we can here, but again, if they don't have any insurance, then they are eligible for the VFA program. And if an insurance plan does not cover a particular vaccine, which honestly is pretty rare under ACA, then they would be considered underinsured. So on this screen right here is the Vaccine Eligibility Guidelines. It is a document that we pulled together. It is available on EasyIZ, and we'll talk about resources in a few minutes. But I wanted to point out that this particular guide was created to really inform you on the differences between the Vaccines for Children's program and the California Vaccines for Adults program. So this program this guide will tell you the eligibility by age, and then insurance eligibility, and also includes the vaccines that are covered within each program. So with that, I will, one last document. We do also have the eligibility screening and documentation. I do want to note that eligibility must be documented. We have one of 3 ways that you can document eligibility. We have a paper-based form, which you can see here on the screen, and is also available online. You can use the registry, so you can use the California Immunization Registry, or you can use one of the local registries that are in your area. The other option, which I believe most of you have access to, is the electronic health record that's in your system already. If you do use an EHR, just be aware that you have to be able to pull out the data on eligibility screening. So however that's done, an EHR is a method. I know that you can use one of these methods, or you can use a combination. And I know many that do a paper-based system along with their EHR, so that they know that the documentation is there. Okay, with that, I will now turn it over to Gabriella to talk about the ordering and tracking process.
Thank you, Nisha. Good afternoon, everyone. Thank you for being here today. As Nisha has already mentioned, I will be talking about vaccine ordering and tracking, and also going through some shipping and handling, storage and handling information, and I will end with a brief discussion on reporting requirements. So the good thing is most of you are already familiar with how to order vaccines, VFC vaccines, because you are already doing this. And the process for ordering 317 funded VFA vaccines is similar. The steps are pretty much the same. You are familiar with the steps from our welcome letter. And you will be ordering vaccines, 317 vaccines, for now from the My VFC Vaccines page.
One moment. We have some folks that are telling us that they're having experience with audio. If you are experiencing an audio problem, please raise your hand so we can figure out if the audio problems are on our end. Okay. Thank you for that. Go ahead.
So we are working to develop a page that is going to be dedicated to ordering My 317 vaccines, and the page is going to be available later this summer, and you will be all notified when that is open. But for now, we use the My VFC Vaccines page. This is a list of the steps you have to follow in order to place a 317 vaccine order, and they're all included in the welcome letter. I will be going through these steps, but showing you the screenshots and how this looks in real life. So you're going to be ordering by going to easyIZ.org, My VFC Vaccines, and there's a button there that says Order, Transfer, or Return Vaccines that you're already familiar with. You are going to need to enter your VFC PIN and zip code, and then click on the button that was created that says Order 317 Vaccine right under Order VFC Vaccine. You are going to have to confirm that your practice delivery information is correct, and you're going to be taken to the 317 vaccine order form. This is the form, and for the first order, you are going to need to say what type of vaccine, so you choose that from the drop-down menu, and how many doses you need. And here I want to make a parenthesis and say that this is new to us as it is for you. We are going to be needing a little extra time to process this first order, so please be patient. The other thing I wanted to note here is that this is for the first order. For all subsequent orders, you're also going to have to provide us with information on the doses you have on hand and doses that you administered. And that's at the top in the orange and the dark blue header. So, but this is for the first order, just for that. And so after you do that, you're going to have a chance to preview your order and confirm that everything is correct, and then you're going to have to submit to place your order. We received a lot of questions about what is an appropriate number of doses to order, and we appreciate the fact that you're turning to us for that type of information. However, I think we recognize that clinics are best equipped to answer that question. You are the ones who know how many patients you're seeing, how many patients are eligible to receive these types of vaccine, so you are the best equipped to answer that question. The initial order is going to have to be placed by June 30th, 2016, and it will be for 2 months supply of 317 funded vaccines. And then every order thereafter will have to be submitted on a monthly basis. The vaccine shipments, if you are placing VFC and 317 VFA vaccine orders at the same time, the shipments will arrive in the same shipping container. And the doses will not be individually identified as VFC or 317 vaccines, but the packing slip is going to help you with that, because that will help you identify the VFC doses and the 317 doses based on the order ID, lot number, and the funding source. After you receive the vaccine shipment, you have to label the vaccines received according to their funding source and store them in the pre-designated shelf or area of the vaccine storage unit. And this brings me to a very important step that you have to take before you place an order, and that is looking at your storage area and determining how to best organize it so you have space, adequate space for 317 VFA vaccines. And this is in addition to other storage and handling key elements, such as making sure that your staff is trained for that, that you have the accurate temperature monitoring equipment, and that you have plans for emergency vaccine management. And also when you do that, maybe it's a good idea to keep in mind the peak immunization periods, such as back to school and the flu season. So now we're going to switch gears slightly and talk a little about reporting. Your first report due date is due October 1st, 2016. That's a little over 3 months from now. And then the submission frequency will be every 2 months after that first date. The reported data at minimum, we will be wanting to see doses used and doses on hand, but we are also going to want to see some additional reporting elements because we want to see the program success. We want to see some evaluation measures, and we are going to be sending you plenty of information, and we're going to give you enough time to gather that data so we can have some program implementation measures we can look at. I will be ending with some forms that we have for you. They can be found on our website. for tracking and reporting. The first one is the adult vaccines daily usage form, and then the other one is adult vaccines physical inventory form. You know how they look like. Hopefully you looked at them. You had links in the welcome letter for them. The other thing that I wanted to say here is, for example, if you're using CARE or a local immunization registry, you are not going to have to use the daily usage log, so you don't have to do double data entering. I'm going to end here, and this is a good transition to our next segment of the webinar. Anya Gutman, my colleague, will be talking about program materials and resources.
Thank you, Gabrielle. Good afternoon, everyone. I'm going to be talking about some program materials and resources, both on the EZIZ website as well as the CDC and the Immunization Action Coalition website. So starting out on eziz.org, you'll find links to the California VFA program overview page and the California VFA resources page by clicking on the links indicated with a red arrow in the red box on the top right-hand side under New. Bear with us as our web page is under construction right now, and we're incorporating these two important links onto our home page. Here's a screenshot of the California VFA program website that you can use as a reference for information about the program, including program eligibility and requirements. You'll also find a link to VFA resources at the bottom of the page. On the resources page, you'll find the forms you need for eligibility screening and vaccine storage and handling that we've talked about today, as well as links to trainings such as the EZIZ trainings, job aids, and other program materials such as the VFA patient flyer shown in the top right-hand corner. We encourage you to use this form to promote the VFA program among your staff and patients, posting in the waiting room, exam rooms, providers' offices, and more. Another resource is the CDC's Immunization Adult Patient Intake Form, shown at the bottom of this screenshot, which can help you assess current vaccination status during a patient's clinic visit for proactive vaccination. I also wanted to point out the Immunization Action Coalition screening checklist for contraindications to vaccines for adults, also at the bottom of the page. A hard copy of many of these resources will be sent to you in a welcome packet around the end of August, beginning of September. And from this page, you can also click on the immunization materials for staff and patients to find more resources. EZIZ.org has a wealth of immunization resources, including many disease-specific adult patient education materials that you can download and print at no cost. You can see that several of the materials are also available in Spanish and Chinese. Printed copies of some of the materials for pregnant women can be ordered from your local health department immunization program. Click on the link on the immunization program link at the bottom for the contact information for your local health department. Please let us know if you have any trouble getting these materials. And you can see that under the Adults tab, there are links to the CDC and Immunization Action Coalition resources for providers, staff, and patients. I'm going to talk a little bit more about those in a little bit. There are also links to more materials that are specific to flu and whooping cough that you'll see links to below, as well as schedules and recommendations. These three resources, the CDC's 2016 Adult Immunization Schedule for providers and two CDPH patient education materials on immunization during pregnancy, will be available to order through the VFC store later this summer. In the meantime, these materials can be downloaded using the links above, or as I mentioned before, the two immunizations during pregnancy materials will be, or can be ordered through your local public health department. And now I'm going to point out some of the CDC's adult immunization resources. They've got some great resources to help you promote and educate staff and patients on adult immunizations in your clinic. They have patient-friendly immunization schedules, strategies for increasing adult vaccination rates to be able to promote vaccinations in your clinic, to downloadable patient education materials on the ACIP recommended vaccinations. You can also access the ACIP guidelines in the left-hand column. In addition to these resources, there are also various template communications, such as web buttons and banners for your clinic website, radio PSAs that you can, for example, play in your waiting rooms or while a patient is on hold, sample posts for your social media sites, and more to help you promote adult vaccines to your patient population in different ways. As I just mentioned, the CDC has a great patient-friendly adult immunization schedule that's, as I said, easy to read and includes recommended vaccinations for adults, both by age and by health condition. And this is a material that providers can use to educate their patients on the immunizations they might need. And then finally, I wanted to highlight the Immunization Action Coalition's adult vaccination page. They have also a wealth of resources from job aids for administering vaccines, screening questionnaires for proactive vaccination, and for identifying contraindications and risk factors for specific diseases, template standing orders for routine immunizations, patient health education materials, and also patient-friendly schedules. The Immunization Action Coalition, they also have an online publication that's called Vaccinate Adults. It's on the right-hand side there. And it includes the latest resources and also an Ask the Expert section. It's free to subscribe, and we're encouraging all of the VFA sites to sign up. So just in closing, please take some time to check out the different resources that I've shared with you today, and then bookmark some of these websites on your web browser. We encourage you to share these resources with your fellow staff and providers, and talk about the ways that they can be used in your clinics. We'd love to get your feedback during following webinars on which resources you find most useful, and if there are any resources that you think are missing. We'd also love to know if your clinic has developed any great resources that you're willing to share with the group. Thanks so much, everyone. And now we'll turn to the questions and answers period of this webinar.
So again, if you have a question and you'd like to use the telephone, please use the hand indicator on the screen, and we will unmute your line. Okay, Ashley, your line is open. Ashley? Gabriella, your line is open.
Oh, no, I'm sorry. I didn't have a question. Mine, for some reason, keeps raising my hand without me raising it.
Okay.
Okay, we'll try to remember.
Okay. Next is Isabella. Do you have a question? No? Paulina, your line is open.
I'm just wondering where we can get those cool stickers to like determine which ones are 317 and VFC funded, because I know where to get the VFC ones. I just wonder where the 317 are.
They are cool stickers, aren't they?
Yeah, I need some of those.
We plan on having them available through the VFC store, where you can find the VFC stickers now. That will take a few weeks, though. So which county are you in?
Santa Cruz?
Santa Cruz? Okay, you can also check with your local health department. They may have some small supplies to sort of get you through the initial shipment, but the plan is to have those stickers available on the VFC website so that you'll be able to order and have them shipped directly to you.
Great, sounds good. Thank you.
You're welcome. Should we do the online questions? Okay, so we're going to take a few that have been submitted online. First question, do you know of any quick and easy way to verify if the patient with Medicare has Part D or Part B? Many of our elderly Spanish-speaking patients are not aware what plans they have and don't always have their Medicare card with them. So when you're doing your intake form, you are just asking if they have insurance and not necessarily looking for verification. If they can't tell you Part B versus Part D, then you assume they don't have it.
And I think Part D is the drug benefit coverage, so oftentimes that is what covers that component of the visit.
Right.
So I think that would be one way of finding out. That may be also a key important aspect of having clinics discuss this with, your normal intake process and billing is, how do we know, how do we determine, and how do we screen as you're implementing this program within your clinic. The coordination with your billing department and screening will be key. By the time a patient gets to the immunization area, a clear distinction really needs to be made, as it is done with the VFC program.
Okay, next question online. Will we be able to start administering doses as soon as we receive them? Yes. As soon as you get them, the assumption is that you've got your screening and eligibility, documentation, everything worked out, and yes, we encourage you to start vaccinating. Next question, how soon can we expect to receive shipment of ordered vaccines? I believe Gabriella mentioned that the turnaround time will be a little longer on the first shipment as we're still kind of working through the mechanism on our end. But usually we expect the first doses to be shipped within 5 to 10 business days, and that is a 2-month order that will arrive. And you will get an email confirmation just as you do with your VFC doses, so you'll know when the order has been transmitted and that they should be on their way soon. Okay, next, is shingles vaccine included in VFA? Yes, it is. What happens if we give a patient that does not qualify for this 317 program? Very good question.
So hopefully this shouldn't occur. I think that, as I mentioned earlier, I think the screening component, the separation of inventory, is going to be one of the core aspects as you implement this program. I think most of you are, all of you are actually a VOC participant as well, and you know the importance of screening documentation and keeping vaccine inventory separate. I think if you accidentally happen that ended up happening, just make sure that you're clearly making a note and put measures in place so that does not occur again. I would clearly make a note as to what the situation happened. When certainly site visits may be a component of this program, so you'll have clear documentation and plans in place to absolutely prevent inadvertent administration from different vaccine supplies.
Great. All right, let's go back to the phone lines and see if we've got any other questions here.
Now, most of these are from people who are calling in using their mic and speakers, so we'll give you a quick shot at audio, but most likely you need to use your phone line. So we'll open up the phone line now to Darcy. Darcy, your phone line's open.
Oh, gosh. I don't know.
Hello?
Hello?
Yes,
oh,
we can hear you.
I don't know. I'm in a rush today. Will there be a way or some sort of menu or maybe site through CDPH for VFA grantees to be able to communicate with each other so that we can sort of like in the event that we can't get a hold of somebody right away, we can just sort of how are you dealing with this, or lessons learned, or as we go be able to share our problems and questions.
Sure. So that's a great question. We do plan to hold at least quarterly webinars. So this type of venue, and the plan is that we would present for a small portion of it, and then we would open it up for a Q&A and discussion amongst all of you. So that is the plan for the future. We don't necessarily have a listserv or anything set up at this time, but certainly open to any suggestions you may have, and we'll think about them.
Maybe we could just use social media or something like that.
Okay, we'll think about it.
Next, Robertina, your line is open. Okay, looks like we don't get audio from you, Robertina. You can try to answer or ask your question through the questions panel. Diana Montero, your line is open. Okay, Diana, looks like you're also using your mic and speakers. You can try asking your question through the questions panel.
We've got a few others online that I can go ahead and answer. We are supposed to place orders monthly, but what do we do if at that time we do not need to place an order? And that is completely fine. If you still have supply, you will still be required to submit an inventory and inventory report just so we know how much vaccine you're sitting on. But you are not required to place an additional order if you don't feel like you've completely gone through your current supply. Okay, so which was the third vaccine not included in the VFA program? Flu, Men B, and what was the third vaccine?
Those are the only two.
Those are the two. So it's actually only two. It's flu and Men B. When are the vaccines going to be available to clinics? You should have received an email communication, I think that's why you're on this call, last week, and that email communication includes ordering instructions. You have until June 30th, which is next week, to place your first order. So if you have not placed it yet, we encourage you to do so in the next several days. Your order will be based on it's a 2-month order that you're placing. So think about that carefully when you place that order. Take a look in your refrigerator to make sure you do have space for these doses as they come in, especially if you are ordering doses of multiple vaccines. For the first report, we have to submit in October. How will we submit it? It will be online in some form. We are still working out the details, but it will be submitted online. Once we receive our vaccines, are we cleared to begin administering to eligible patients, or is there a start date? Nope. Once you get the vaccines, you can go ahead and start vaccinating.
And we are smiling as we're answering that question.
So I guess the start date was yesterday. Will the VFA program provide us with containers for vaccine storage? The answer is no. You should have storage available. That was part of the initial application process where we asked if you have room to store vaccines now. Will the clinic be told ahead of time when an audit will occur, or will it be done randomly?
I think a little bit of both. Certainly, as we do with vaccines for children program providers, we may conduct unannounced storage and handling visits. The primary purpose of that is to ensure vaccines are stored and monitored appropriately. I think certainly the frequency of site visits for vaccines for adult providers are still being determined. So I think as we do proceed to that component, we will also make sure that we notify you how that will happen.
If a patient has Medicare Part D and is elderly, it is recommended that they get Zostavax at the age 60, but Medicare doesn't pay for it until age 65. So can we use the program for these patients? So if you're talking about 60 to 64-year-olds, they should not have any other form of insurance to be eligible for this vaccine. So they still have to be uninsured. So if they don't have insurance of any sort, then yes, you can give them Zostavax. Okay. Do we have any other via the phone?
Yes, you can try to open Linda's line, Linda Rangel. Oops, Linda took her hand down. Sheena Toledo.
Oh, Sheena, are you calling via your computer?
Yes, she is. Okay. Gloria Mata. Gloria, your line is now open. Okay.
Okay, so let's go back to more online questions. Does each clinic need to sign an MOU with the local department to use 317 vaccines? No. Does VFA have the same eligibility as VFC with Native American and Alaskan patients? The answer is no. Actually, can we move back to the slide with the eligibility guidelines? This one document we really encourage you all to print out and to post. It's in the slides, yeah, just go back. It's whatever was up a moment ago. Yes, that's it. Hold on one moment. I think you just scroll up. Yeah, maybe go to the other slides that was open. Sorry, we're just trying to get back. Yeah, just scroll backwards. Oh, yeah.
We're getting there.
There we go. Okay, this is very important to keep up because it does distinguish the vaccine eligibility guidelines for VFC versus VFA. So Native Americans, Alaskan Natives are not eligible for vaccines for adults program. Everything here tells you the distinction between VFA and VFC, and so that is one important difference between the two programs, as well as Medi-Cal is Medi-Cal eligible patients are eligible for VFC, but Medi-Cal adults are not eligible for VFA. All right, let's see, next question. Given your, given your recommendation to increase vaccine orders during projected times of increased demand, will we be allowed to increase our vaccine orders? So the orders are generally based on what you've already administered. So if you're going to be increasing an order that is different from your past orders, it may require additional approval and justification for why you're wanting additional doses. So I assume that that might be because you've got some larger clinics planned, or you've got something planned in the fall coinciding with something else, and that's why you anticipate additional doses. But we would require more information if you're going to order additional doses.
And I think the notes section on that 317 order form will also facilitate you communicating with us the reason why you might be requiring an increased doses beyond the number of doses that you have been administered over the past several months.
Thank you, Claudia. And then someone did note that the website transactrx.com will check for Medicare Part D coverage for a Medicare beneficiary. Okay, next question. For a temperature excursion, would the process be the same as VFC? Yes. The same system will be used.
And just as an addition, we're actually modifying the system to be able to also reflect adult vaccines. For right now, the system is geared up for VFC providers, and therefore vaccines that are showing up are primarily VFC pediatric vaccines. But we're in the interim, you can submit it, and then we're working on adding just a few additional vaccines that are not showing up as part of the inventory that would be reflected to be selected.
Okay, let's see. Okay, will a person be eligible for vaccines if at the time of visit they don't have a medical at that visit? Medi-Cal. They don't have, correct. I know sometimes they haven't submitted paperwork needed and they have lapses in coverage. So if at that visit, at that encounter, they don't have Medi-Cal, then they are uninsured. My question is, one, receiving vaccines, are we going to input them on the care system, and will we be able to run a report to keep track of these patients for the 317 program? The answer is yes. Let's see. In case of a power outage or an incident, are we reporting it the same as VFC? The answer is yes. Yes. Is it a requirement to be enrolled into VFC in order to provide VFA? The initial applications that we have approved were all VFC providers. That is the first group of providers that we are working with right now, which is all of you. When are we required to send an inventory report? You'll be prompted to send an inventory report once you get ready to place your next order. So your first inventory report will likely be in 2 months when you get ready to place your next order. Just to clarify, this is only for patients that have no insurance. It's those with no insurance and those that are underinsured for certain vaccines. We have, let's see, no more BSM. Will we be able to transfer 317 vaccines within our agency to those who are also approved for 317 vaccines, similar to VFC?
Yes, transfers are limited. We don't encourage transfers routinely. And I think, as I mentioned earlier, if you're transferring vaccines, you would follow the same procedure as with VFC. You will let us know the reasons why you're transferring vaccines. Certainly, there is a situation in which a number of organizations may have applied, and only some of the organizations actually have been initially approved. Some of the other organizations may be waitlisted. I think I mentioned at the beginning, we have limited funding for 317. It's not like our VFC program, which is an entitlement program, and funding is available. So I think transfer for vaccines, 317 vaccines, to organizations that have not yet been approved should not occur. If you need to transfer vaccines for 317, you would let us know, and then you would then, with approval, document the transfer on my VFC vaccines. Soon, hopefully, to be my 317 vaccines as we separate the transactions for both vaccine programs. There's a question here. If we do not have a VFA vaccine available, are we allowed to substitute a VFC vaccine? And the answer is absolutely not. Unfortunately, both of these programs are federal programs, and they're guided by eligibility. So I think utilizing vaccine supplies must only be done with the eligible populations. I think that's why it's critical that vaccine supplies are nicely labeled and organized in your refrigerator, and borrowing is not allowed under any circumstance for VFC supply vaccines or 317 vaccines.
If a patient does not have insurance, do we charge them with the minimum fee of $26.03 for each vaccine, or for all vaccines that they will be receiving? I think it's $26.03 per dose.
It's $26.03 per dose, and I think you would follow whatever procedure you normally have. On federally qualified health centers, you normally may have already an established fee, particularly if you're already offering immunizations. So it should be in alignment with whatever you're already charging for vaccines.
Okay, we'll take a call from the phone now. Paulina, your line is open. Do you have a question?
Yeah, I just have a question regarding the first order. I know it has to be placed before the 30th. I'm just wondering, are we supposed to be ordering one of each, even if we don't think we're going to be using it, or is it okay to just order the ones that we're going to be for sure using?
Paulina, just order what you plan on administering. So whatever your original, you submitted your application, you had some sort of plan in mind, and so if that's certain vaccines only, then we certainly want you to order what you think you can administer in your clinic.
Awesome. Okay, thank you.
one of the things we would encourage clinics to do is to have conversations as you're receiving and ordering vaccines with your clinician group and decide the approach that you're going to do in implementing VFA. How are you going to start targeting your populations? Will you start with your high-risk adults that are already being seen? Will you do general outreach to all populations? So that certainly will depend the vaccines that you're starting with.
Great.
What is the, I think that we've answered this a couple of times, what is the typical turnaround time for a new order? It will probably take 5 to 10 business days, so place your order via the system and then we will work on getting those doses to you. So patients that, question, that qualify start at 19, is there a cutoff age? No, there is no cutoff age. Starts at 19. Let's see.
So there's a question, after June 2017, will we be notified if you can continue to order VFA vaccines through the program? And certainly you will we'll be assessing our funding levels throughout the program. And actually it's a good segue for me actually to mention that in your communication that we send to all approved sites, we mentioned that it is critical that the first order, seed order for 2 months is placed by June 30th. The second critical piece that we will be evaluating is how the clinics are quickly implementing the program and using vaccine within the first few months of the program, so that way we can see the level of funding and utilization for the program. So as we get closer to early next year, we will certainly be notifying about the expansion of the program, which hopefully we hope to continue.
Okay, we've got some questions about Medicare Part B and Part D. So just want to remind you that verification of Medicare Part D as in dog is not required. You are simply asking if they have Part D and noting what they say. The Part B Medicare, so we do have several documents and screening tools that we're working on, and we hope to make them available to you soon to sort of distinguish Part B as in boy versus Part D as in dog, which vaccines are covered under those. For Part D, it is zoster and then Tdap in non-wound care situations. Everything else is covered under Medicare Part B. So if someone comes in with Part B and doesn't have Part D, then they qualify for Tdap and for zoster.
Bertha, we're unmuting your mic and speakers. Do you have a question, Bertha? Okay, we cannot hear you. We'll take a written question.
So the next question is, do you foresee the eligibility guidelines changing when this program is close to ending? And I can tell you that we don't actually anticipate that eligibility guidelines will change, even initially or after the program. Eligibility guidelines for the receipt of 317 vaccines are federally guided, so it is unlikely that the guidelines will change.
Are there tools available to identify coverage eligibility and covered vaccines? We do have a few tools, I think. We've had a few, and I have to check because I think that there are also tools available at the federal level too. We'll look through what we have and what's available from other states and then make them available on the same web page where we have our other materials available. Okay. Our facility receives state general fund flu and Tdap for our uninsured with the VFC Tdap is also available. Would we still need to order Tdap through our state general? That is completely up to you as you sort of take a look at your uninsured population and vaccines that you have available. Let us, take a look and then work with your local health department to figure out whether or not you still need state Tdap. Let's go up a little bit. We've got one more.
The question, I think, was if they had multiple sites that were approved from the same clinic, how do they place the order? And the answer is individually, so each site should place an order. Each PIN.
You're placing an order by PIN. So even if you submitted applications for several sites, you will then submit order individually for each PIN.
For each of the approved sites that you received an email for.
Yes.
And then there was also another question related to the use of PINs for ordering vaccines. And yes, you are using the same PIN to order 317 vaccines as you are for VFC.
And we only administer vaccines to patients that are seen by our practice. I'm not sure if you mean, can you offer it to other patients outside your practice? You can offer it to anyone who meets the eligibility guidelines that we shared with you. Do we get penalized for? Oh, okay, sorry. Do we get penalized for expiring vaccines if doses are not used by an expiration date?
So that's a tricky question, and I think penalizing well, I think that's what it sounds like. I'm dancing around answering the question, but basically what I'm trying to say is we have limited resources for 317 vaccines, and we certainly have much more applications than we were able to approve initially because we have a limited amount of 317 funding. So we're really stressing the fact that ordering appropriately and really making sure that vaccines are managed appropriately and targeted appropriately, it's a key aspect as you implement the program because we certainly don't want to see any vaccine expiration. Vaccine expiration, it is considered negligence because we should be managing the vaccine. So yes, I mean, I think we don't want to see vaccine expired, and if you do, you know, as with VFC, we consider that a negligent loss because it could be preventable. But however, I mean, I think I'm anticipating that the demand and the success of this program is going to be great. So hopefully we're not going to have any vaccine expiration within the practice. That's the other reason why we're actually asking you to order monthly so that you can really keep a close eye on how much you're ordering and not ordering a whole bunch of doses all at once because you could get into that situation for vaccine expiration.
Okay, we'll take one more. We're going to answer one more question, and then we've got one last poll. We want to end on time today. So if a patient has a copay, is that considered insured, and therefore they must pay out of pocket for vaccines? Yes. If they have a copay or a high deductible, both situations, they are still considered insured, and therefore do not qualify for the VFA program. Okay. So thank you. Many of you have submitted lots of questions, and we apologize if we didn't get to them all. We hope to be able to collapse all of this information into a Q&A document that we'll make available for you. We've got one last poll question. We are looking at, as I mentioned earlier, we are interested in doing webinars for all of you on a quarterly basis, but we'd like to hear from you as to which topics you'd like to hear from us. So we've got 3 topics listed here. Go ahead and select one, and we'll take that information with us as we start planning for the next webinar. Go ahead and submit your questions. And just as a reminder, if you've not submitted your order, you have until June 30th to place your order. Okay. You see the polling coming in. I feel like I'm on CNN with those polls. And it looks like about 50% of you are interested in successful strategies for reaching uninsured. And many of you would also just like a review of the adult immunization schedule and reviewing the recommendations. Okay, well, thank you so much for that info. And again, thank you all, and we'll go ahead and end today's webinar. We'll be in touch, and if you do have questions, by all means, submit them to my317vaccines.com, and one of us will respond back to you. Thank you all.